Most of our patients we see, the main condition we see is chronic migraine. Now, these are not just your everyday headaches. These kind of patients suffer daily with severe pain, and lots of other symptoms that go alongside it: extreme nausea, extreme vomiting, dizziness, vertigo symptoms, and it affects their whole quality of life, their ability to work, their ability to have family time, look after their children. It impacts it on such a wider basis than just day to day. It impacts on family life and things like that. So having treatments that are available at the correct times is what makes the vast difference to their quality of life.
We have increased our team, so we'll be able to provide more services to more people with migraine and headache disorders in UHP. And as a result of one of our pathways, I was very fortunate to be invited to an NHS England event to explain how we've been so successful in the rollout of non-invasive nerve stimulation for cluster headache sufferers. Cluster headache is a completely different condition to migraine, and they wanted to know why us here at Derriford have been able to prescribe over 40% of the prescriptions for the vagal nerve stimulator to cluster headache patients. So basically I was asked to present on how I was so successful, so that with a view to rolling it out to other centres across the country.
So I think looking at numbers, since I joined a year ago, we've kind of had about a 50% increase in the amount of patients we've seen by an appointment. So we've been able to offer more timely treatments, which means our patients are being less debilitated with delays in their treatments. In terms of chronic migraine, in terms of our cluster headaches, we've been able to offer a more responsive service. So we, when they make contact with us needing kind of an acute treatment from us, we've now been able to respond to that within about 24, 48 hours, giving them those treatments to kind of try and, stop them from being in those really long periods of debilitation, with their conditions.
Other centres, they haven't got headache nurses. There's only 70 of us across the country. So, and even where there are nurses, it's deemed as a consultant-led service. So, so patients have to wait a long time to see a neurologist, whereas we've developed a pathway so that cluster headache patients see us very quickly. So for cluster headache, they don't respond to usual migraine medication, so they have to try really horrible drugs, heart drugs, which need lots of monitoring, lithium, which comes with lots of horrible side effects and needs lots of monitoring, and this was a no-brainer. So it's something that they use in their own home, don't need to come into hospital for. We speak at national and international conferences about our team, and a good many want to replicate that, which is amazing, because we want the same services provided to everyone, so that there's no inequality in healthcare. So that's, we are happy to share our model with anybody. We recognise that there's a national shortage of neurologists across the country, and so CNS is particularly in headache we're passionate about, and we should really be upping our game, upskilling, and upskilling our counterparts over the country to try and get the best care for our patients.